There's no doubt that we're all feeling the pressure and anxiety regarding the COVID-19 global pandemic. This was a topic of discussion for three East York neighbors. Among them, they discussed their personal struggles living in an age of a pandemic, the emotional ups and downs of self-isolation, the growing discussion in the media about anxiety and mental health and its effects, even on children as young as 5 years old. Being proactive and wanting to stay connected with fellow East Yorkers, they felt others in the community might be in need of expert advice, so the trio reached out to boots-on-the-ground local mental health professionals and assembled a panel of representatives from Stella's Place, a youth and family mental health organization, Whitgreen Mental Health Addiction and Developmental Services, Kids Help Fund Canada, and a registered social and community health worker to participate in a mental health check-in town hall with the community at large. Discussions in the media regarding mental health issues are more prevalent due to the restrictive precautionary actions deemed necessary to combat the coronavirus. According to CAMH, in any given year, 1 in 5 Canadians experiences a mental illness or addiction problem, and by the time they reach 40, 1 in 2 have or have had a mental illness. Mental illness and addiction refers to a range of disorders that affect mood, thinking, and behavior such as depression and anxiety disorders. It's difficult to find estimates reflecting how many Torontonians have been seeking out mental health services, as data is currently being gathered. There are websites such as mentalhealthcommission.ca, the Government of Canada, and StatsCan that are requesting people participate in surveys and document their emotional experiences. The CBC reports that an Angus Reid survey suggests that over half of Canadians say their own mental health has deteriorated over the past weeks, and, quote, a significant segment of that group says it has worsened a lot. Now that is a finding that really sticks out. If you find yourself, like many others during this difficult time, in need of mental health supports, please visit sites like Wellness Together Canada for no-cost counseling and wellness assessments. Links to the services are provided at the end of the video. Presented today are the results of people helping people. The hope is that the information and comments shared will be helpful in underscoring that we are all in this together. I'm Dawn Jobson. Thank you for supporting the Toronto Community Media Network. Be well and stay safe.
Hosted by the Toronto Danforth Provincial Liberal Riding Association, and it's our second virtual town hall. My name's Karen Somerville, and as president, I'm pleased to have you all participate in our discussion on mental health and coping strategies in this time of the COVID-19 crisis. So even though each of us has to be physically separate, the riding executive was eager to find ways for us to connect on a personal level with our community and to do it in a nonpartisan way. So a few weeks ago, we had our first town hall and we talked about the housing crisis. And tonight we're going to discuss mental health and the unique pressures and anxieties that come from living in the present crisis. I wanted to thank the Toronto Danforth team for working together to get the town hall a reality, and thank each of you for participating. It's a very important topic. And now I would like to call on Kelly Lynn Ashton, who's our communications chair in the Toronto Danforth Liberals. And Kelly Lynn is also going to be our moderator for tonight. She'll introduce each of the speakers and outline how we're going to proceed from here. So thank you very much.
Thanks, Karen. Sorry. It's always a little harder to remember to unmute.
Yeah.
So just to set the stage for what we're doing, how we're going to do this, I think we're going to keep everybody unmuted for the discussion. And then at the end, there's an opportunity for Q&A, and then we can unmute everybody for questions and answers. There's also the chat. So if you don't feel comfortable asking a question, you can write it in the chat and then we'll read it out. I can read out the questions. So there's different ways that you can communicate. One of the reasons, I think one of the timely thing about this is that just a couple of days ago, Angus Reid released a poll, a survey of Canadians on their mental health, their perceptions of their mental health during the COVID crisis. 50% of respondents said that they felt their mental health had gotten worse during the pandemic. 10% said it had deteriorated a lot. So I think it's safe to say that most of us have a feeling that we're not in as good a shape as we were. So we wanted to have this session so that we're going to start off talking about things that everybody can do to try to feel better. And then we'll talk about some things for those who are having greater challenges. So we'll start off with Lee Koo, who's an educator with Humber, as well as an active Liberal on many fronts. And Jamie Lemon, a social worker in the community mental health field, followed by Julia Chow. She's the Director of Mental Health, Addiction, and Developmental Services at Wood Green. And Martha McGroarty, who is a youth mental health advocate and who volunteers actively with Stella's Place and the Kids Help Phone. So each one of them will tell you a bit more about themselves and how they come to this topic, and as well as then the resources that they have to share. So let's start with Lee. If you can unmute yourself.
Great. Hi, everybody. It's so lovely to see everyone. It's thank you so much, Karen, and thank you so much, Kelly Lynn, and for Julia and Jamie, as well as Martha, for being a part of this. So I just wanted to kind of start off with something that's really general. I think that when we talk about mental health, there's a lot of stigma that's behind it. And I've been working with a lot of students, and I see this on the front line where people become very quiet and people have a lot of anxiety, and that's one of the things that I've seen leading up to COVID and during this time right now. And so as someone who's a practitioner of mindful meditation, just taking deep breaths is something that has made a huge difference, and it's a skill that I actually remind many of my students. And whether they're my own daughter, who's 5 years old, sometimes when she feels a bit stressed, I encourage to take deep breaths. And so it seems something to be very simple, but I encourage everyone as just being mindful of the fact that when you have that feeling, you don't quite know where it's coming from, take a moment, take deep breaths, and about 20 deep breaths can really make a big difference. And just have it's okay, right? Like, and as you're taking those deep breaths, to think about that whatever you're feeling right now will pass. Whatever we're going through right now will pass. We've had to do huge leaps and bounds of our lives being churned over upside down. And so being gentle and kind and patient with yourself as well as with others, right? Because we're all living in circumstances we didn't expect ourselves to. And so taking that time to recognize, is being on social media something that's healthy or not healthy? Is listening to the news every single moment actually healthy or unhealthy? Because if it creates more anxiety, it might be better to just check in at a particular time once a day or maybe twice a day. But what we accept into our system, whether it's listening or watching things online or on the TV or on the radio or whatever we're ingesting, it becomes a part of us. And so being mindful of what makes it healthier for us or not in our own mental health and wellness is really being kind to yourself, being gentle, and really thinking about what your boundaries are, right? And we're all living in different spaces. Being able to get outside for even 30 minutes for a walk is something that's really important. And if you don't have a mask, like a medical grade mask, like even taking a handkerchief or a scarf, if that helps you feel more comfortable, is something that you can do. And so for me, I just wanted to kind of stay very high level in that sense, because if we can establish a routine, because many of us, if you are working or whatever your schedule looks like, every day almost seems like the same day as the last one. So what can you do to kind of provide rhythm and transition from what you do in the morning to what you do in the evening? Setting up calls with friends once a week. We don't know how long we'll be in this state, and sure after we come out of this, things will have changed and we'll have to learn how to renegotiate social practices. And so, but I think the most important thing is for people who are extroverts, this might be a really, really hard time. And for people who are introverts, this might actually feel very comfortable. And so if you know someone who's an extrovert, maybe reach out and just say, hey, how are you doing? Right? I mean, of course, we should be doing that for all the people that come to mind, and just a little check-in with others is also a great way of healing ourselves. So having said that, there's I know a lot of great content that we're going to get into, but I just wanted to leave you with that, with just a few things of, being kind to yourself, being gentle and patient, taking deep breaths whenever possible, and getting outside for a bit of physical activity, or just doing some physical activity for about 30 minutes a day, and reaching out to people that you care about during this time.
Thank you, Lee.
Pleasure.
Okay, Jamie?
Hi, good evening, everyone. So my name is Jamie Lemon, and as Kelly Lynn mentioned, I am a social worker. I have a few different roles. Just to give you a bit of background about me, my current role is as a mental health clinician at Toronto Western Hospital in the Centre for Depression. I also have a private practice out of the Healing Collective, which is a collective of wellness workers and psychotherapists and social workers that's at Danforth and Woodbine. I also facilitate online courses with CAMH around mental health, and I am a volunteer at Wood Green Community Services in their walk-in counseling program. And I'm new to the hospital and actually worked at Wood Green for about 7 years. So I live in the community. I've worked in the community a long time. And so I was asked to kind of speak tonight just about resources in the East End and kind of talk about options for people if they want to get connected to mental health supports. So we're in some very interesting times, as we all know, but particularly around mental health in the sense that there's a lot more being offered right now. Like, as much as there's a bit of this disconnect where we're used to being able to go in and see people and meet with counselors, and that's not happening, I do find there's kind of this interesting way that we're able to offer mental health supports right now, particularly around accessibility and making things free. So I'm going to talk a bit about what are some free resources, what are some low cost resources, and then what are some fee for service resources. So as probably most of you know, how mental health programming is rolled out in this province is it's not generally covered by OHIP, right? There's usually a fee attached to it. There are some programs that are free, but it's not it's kind of a disjointed system. So it's just trying to find the right thing that fits for you. So I'm just going to kind of go over what's sort of available, and they're likely in the question and answer period too. You might even have more things that you want to share and that we want to add. So
and
in terms,
if I can interrupt, sorry. You don't have to worry too much about taking notes, because Jamie and Julia and Martha have given me the links to all the places that they're talking about, and we're going to email that to everybody who's registered for this. So don't worry about getting the spelling down right for the information.
Yeah.
Sorry.
Thank you. So in terms of free counseling services, and Julia's likely going to talk more about this, but Wood Green Community Services is offering, so they traditionally have a walk-in counseling program that operates on Tuesday and Wednesday evenings, and they very quickly were able to move that to the phone. So they're offering free over-the-phone counseling on Tuesdays and Wednesdays. The registration starts at $4.15. There are some other places that offer this kind of free single session walk-in counseling model. So there's What's Up Walk-In, which is also offering free over the phone counseling, and it's geared towards working with children, youth, and families. And they're doing Monday to Friday, 9 a.m. to 7 p.m. Family Service Toronto as well has been able to move their walk-in counseling program on the phone, and they're doing daily from 11:30 a.m. to 6:30 p.m. So again, you'll get all of this information over email. The federal government has also rolled out a free counseling mental health addiction service that's called Wellness Together, and it's in partnership with Homewood Health. So when you go to the Wellness Together site, it's not very clear at first that they're offering free counseling, but if you scroll down and click on the services for adults or youth, then you get to the Homewood Health site that gives you the phone number, and they're offering free phone counseling or text counseling as well. And then I have Stella's Place down on my list, which I know someone else is going to talk about as well. And two other things that I wanted just to mention. Good to Talk is a free phone counseling service for post-secondary students. And out of this COVID-19 crisis, a group of therapists came together under the Mental Health Network and are offering free counseling for frontline workers impacted by COVID-19. So again, as much as like we're under sort of strain sometimes in how we access services, I find that there's a lot more things popping up and making things more accessible right now to access those mental health supports. In terms of low-cost services, the ones that I will highlight are, there's a website called Affordable Therapy Network, and it's a site where therapists can add their profile who are offering sliding scale. And sliding scale can look like anywhere between $20 a session to maybe like $60 a session. And so that's a place, if you have a bit of money and can put it towards counseling, then that's a good resource. As well, there's another collective, which isn't in the East End, but again, everything's online, so we can access a lot of it, is a place called Hard Feelings, which is a collective of therapists that came together who wanted to offer low-cost counseling to people. And even particularly right now, a lot of their therapists are dedicating some free counseling sessions to people impacted by COVID-19. And then in terms of fee-for-service counseling, so I mean, I'm very familiar with the Healing Collective. All of our counselors there are offering virtual sessions right now. There are some that offer sliding scale, and there are some interesting initiatives popping up from the therapists. So I know one of the therapists is offering free counseling for youth. Children and youth who are experiencing kind of anxiety right now. We have another therapist who I think this weekend is going to be offering some free art therapy online. A number of our therapists are offering free meditation sessions online, free yoga sessions online. So the easiest way to kind of get connected with them would be, just add them to Facebook or Instagram, or they have a newsletter that goes out that kind of gives all that information. And then otherwise, there's a number of other good kind of therapy collectives that are happening. So there's one called East End Therapy. There's a place called Wellbe Family Wellness, which is at Broadview and Gerrard. Particularly helpful for any moms, parents, expectant parents. They're running a lot of support groups now for moms who are like expecting kids. So like, if you can imagine, there's all these pregnant people out there right now and are having to think about delivering a baby in the middle of COVID. That would be very anxiety producing. So they're offering lots of free supports around pre and postnatal health. There's PAPE Therapy Center, Soul Spring. And then in general, just kind of broader than that, there's a couple other ways to access therapy or mental health counseling. So one is through an organization called BetterHelp, which just connects you to an online therapist, or Green Space. They're kind of umbrella organizations that sort of host therapists and then connect you to the right therapist. I would say like a couple other things to mention. I think another good program that runs online and over the phone, even outside of these times, is called Bounce Back. And it's a free online guided self-help. So it uses tools like cognitive behavior therapy. You get connected to a coach. So it's not quite mental health counseling, but it's a really great way to just kind of start working on building your wellness toolbox, kind of building on some of those other strategies that were mentioned earlier. Yeah. So I think I will pause there. I feel like that's a lot of information, and people can maybe ask me questions at the end, or we can just open up the discussion about kind of resources, and if you're looking for support, where to get started.
That's good. Great. Thank you. Julia.
Sorry, I'm just unmuting myself. Thank you again very much for the invitation to join this discussion. Again, my name is Julia Chow. I am the Director of Mental Health, Addictions, and Developmental Services at Wood Green Community Services. I think what I'm going to do is highlight a few things that we're doing at Wood Green that could be.
Julia, sorry,
yes.
Can you speak up just
Sure.
a touch? Sorry.
How's this?
Thank you. That's
Is this
better.
a bit better?
Good.
Okay,
Good. Thank you.
So what I'm going to do is I'm just going to highlight a few things that Wood Green is able to offer. So Jamie touched on our walk-in counseling that is now gone virtual by phone. And again, that information will be available to folks in terms of how to sign up for it. Basically, it's first come, first serve. There's a process that you can get connected, and it's roughly about an hour, single session, meaning that we have a counselor available to speak to an individual for roughly about an hour. It can be about anything. It could be about the situation, you know, anxiety, depression. It could be concerns around what's happening, financial concerns, um, employment, unemployment, family relationships, you name it. Our counselors are available to really talk to anyone through that topic. We generally get folks who are adults calling through. Jamie did mention that there is WhatsApp walk-in, which is more geared to children, youth, and families. The other, I think, service that I want to emphasize is really focused on seniors in the community. So we actually are the lead organization for the Toronto Seniors Helpline. You actually might have seen our organization or the service on CP24. The City of Toronto has actually been helping to promote a lot of phone lines that will help connect folks to different types of supports and services. What's interesting about Toronto Seniors Helpline is that our staff can actually help people figure out what's still available for seniors to connect to in the community, who's doing what, who is still able to provide services. Although it's not specifically East End, our staff are quite familiar with the East End services. The nice thing about Toronto Seniors Helpline is that it's also a place where people can just call seniors, especially who are marginalized or who are at home, who don't really have family or isolated. If they just want somebody to speak with, they can also just call in and speak to one of the staff there. We also know that there are folks in the community who really don't have anybody else, and things might be falling apart very quickly. And so we still have through the Toronto Seniors Helpline a mobile outreach team that will go out and do a visit with a senior to try and figure out what's going on and to try and connect and support in a psychosocial crisis. So that's again also available through Toronto Seniors Helpline. And so that's a good resource. It's a general number. We've been getting a lot of questions from not just about the regular, what's out there available for seniors. We actually have been seeing an increased number of calls around food and food security. Where can I get food? How can I get groceries? I can't go out. We've actually have seen a increase in number of calls around just even health. People feeling, am I symptomatic? I'm having this issue. Am I experiencing COVID symptoms? Am I not? So we are trying to ensure that people are connected so that they can get, an assessment around that. The other big issue has been on the financial side of things. There's a lot of different announcements about a lot of different kind of financial supports. It is somewhat challenging to navigate right now. We're also, traditionally we would be in tax season and filing taxes. People are on government income. So how does that impact? So our staff have also been answering a lot of those questions as well. Um, and and so, if you do know someone who has those questions, um, it's an easy number to call. It's one number, and actually, they can ask a lot of questions to our staff there. So that's Toronto Seniors Helpline. One of the new initiatives that I want to highlight is that we used to have a friendly visiting program where we would match volunteers with a senior, and they would do visits in the person's home. What we've been able to do is quickly change the service to what I call virtual friendly visiting. And so seniors can actually be signed up by other folks as long as they give consent to share their name and their phone number and receive a social call from a volunteer. We do have capacity to actually talk to a lot of seniors. So that's also now available through Wood Green, is the virtual friendly visiting. So I think those are the three kind of programs or services I want to highlight that's more relevant to our discussion around mental health and having to be able to connect seniors who are isolated, to connect people who are isolated, who are feeling anxiety or depression, or in distress, that they can certainly connect with. We are actually working really closely with Gerstein Crisis Center as well to ensure that we can support folks in crisis. And hopefully, maybe in 2 or 3 weeks, we'll be able to offer a online group specifically focused on seniors that's really looking at a recovery model. And so there's definitely a lot of opportunity for new programs and new services to come on board. And I'll stop there.
Great. Thank you. Wood Green is doing a lot. We'll talk a little bit more about how people may be able to get involved, I think, after this. But next, and the last speaker is Martha.
Hi everyone. It's great to hear and learn about all these resources that are out there to help people. My experience with mental health, developed as a parent. When my daughter was a teenager, she began having challenges with her mental health and was soon after diagnosed with mental illness. And navigating through the system, we encountered the gaps and the voids. So I started volunteering to help fill those gaps and voids and to give back to the places that helped her. I'm currently volunteering at Stella's Place as a member of their Family Council Advisory. And we work to change the future of young adults' mental health through promotion and advocacy from a family's perspective. And I also volunteer as a crisis responder for the crisis text line powered by Kids Help Phone. So first I'll talk about Stella's Place, that it's near and dear to my heart. Stella's Place has a unique approach, and it's one that empowers participants to manage their own health, which is really what most young people want, right? Is to figure it out for themselves, but also to have the supports necessary to allow them to do so. Stella's Place is with, for, and by young adults, meaning they work with young adults to find their individual path and provide the supports needed to marry evidence-based supports with lived experience and peer supports. So they are for young adults ages 16 to 29, thereby avoiding the gap that many systems bring when transferring young adults at 18 into adult programs. And they are by young adults because young adults have a voice in all aspects, from co-designing the physical structure of the building itself, the location, and the holistic programs and the clinical services as well. So Stella's Place not only offers clinical services, but they also offer peer support, employment, wellness, such as yoga, studios, such as art and recovery programs. They also have an app for online peer support and counseling that is backed up by clinicians, and it's called Beanbag Chat, and that's available Mondays through Thursday from 12 to 9 p.m. and Friday and Sunday from 4 to 9. And those are people call in, and they get their, they can get up to a 45-minute session with a peer support worker or a counselor. For counseling, sorry. Just want to say, Stella's Place, they are leaders in peer supporting and peer support training. It's integrated into everything that they do, and it's extremely beneficial for young people who are struggling to meet with other young adults who have lived experience. And it just makes it more relatable for them and instills hope that they too will get through the difficult times. So Stella's Place is physically located and it's easily accessible to young adults in the downtown Toronto, Spadina, and Richmond area. And it's a community setting versus a clinical setting. And so it's very welcoming. Now, as things have changed for all of us rapidly during this COVID time, Stella's Place frontline staff report significant distress among their participants. But Stella's Place have reacted quickly to ramp up all of their in-house programs to virtual programs and clinical delivery, as well as meeting with their existing participants. They have also been able to see 123 new participants, which is amazing. And they've also reported a 300% increase of the use of their Beanbag Chat app. So this is all really commendable in these challenging times. They've really stepped up to meet the needs of young people without sacrificing the quality of their service. And if I haven't mentioned already, it's free. It's all free. So they rely on the generosity of people to fund their amazing center. And I think it's just really important, just being on working with young people and chatting with young people. One of the things that they find stressful is having to go and ask their parents to pay for services. They don't want to bother them, or their parents can't afford it, whatever the reasons being. This just having this free service that empowers them to develop a wellness plan for them that works for them is just really important. So volunteer opportunities for Stella's Place, you could reach out to their development team. And so they're always in need of volunteers, as everybody is, but they're looking for volunteers with specialized skills. And they're also accepting applications for members of the Family Advisory Council. And their website is very user-friendly, and all the programs are listed there. And the Beanbag Chat is beanbagchat.ca. And I know Kelly Lynn said she's giving a list of resources, so that will be part of that. The other volunteer work that I do, I've been a crisis responder for the crisis text line powered by Kids Help Phone since last August. It's an amazing continuous learning experience, and there's tremendous support from the professional and trained staff and supervisors. So you never feel alone on their platform, and you always have someone to guide you if you're having a difficult conversation, or a new situation pops up and you're not exactly sure how to handle it. They've always got your back. It's really comforting to know that. So, because you want to be the best help for your texter, right? And the goal of every conversation is to take the individual from a hot moment to cool moment. It's really a crisis line, so there's a lot of hot topics coming in, and we just empower the individuals to recall or explore their coping skills and their support systems, help them safety plan, and ultimately leave the conversation feeling heard and validate their feelings. So Kids Help Phone reports that recently 40% of their conversations, text and phone, have been for anxiety and stress. And they've seen a 112% increase in their service since March. As Jamie mentioned about the Wellness Together Canada, that's partnered with Kids Help Phone, Canada Health, Homewood Health, Green Space Health, and Step Care Solutions. And how it was described to me, and if you go online, you'll see it's kind of a one-stop shop for resources. It's for Canadians of all ages, and it's for virtual mental health and addiction tools online. And if you just Google Wellness Together Canada, it's easy to find. The crisis text line, the Kids Help Phone, they've also mentioned to me that the Canadians have really stepped up and met the call for volunteers over the last month or so. They've had a significant increase in people applying to be a crisis responder, and it's been amazing because the 112% increase in their service has, so the extra help is needed, and people have stepped up to meet it. If you're interested in volunteering as a crisis responder, so you'd apply, and then you'd complete 36 hours of training over 6 weeks online, and you'd be committing to 4 hours a week for a minimum of 1 year. And let's see. So again, the crisis text lines, Kelly Lynn will hand out, on our handout, we'll have the text numbers. For young people, it's easy to remember, 686868. And then also they've now also added a wellness text for adults that is part of the crisis text line, and that's 741741. They also you can connect with a professional counselor. So I would be a volunteer crisis responder. If somebody needed to actually speak to a professional counselor, you'd have to phone in to the 1-800-668-6868. And I just wanted to end off by saying that I've seen firsthand over the chats with the young people the increasing need of support. It's just, this pandemic has created so many new and different scenarios for young people. They're facing interruptions in their routines, and they're isolated at home. They feel very disconnected with school being canceled and events being canceled. They may be facing unemployment, or some of them are actually still having to go into work, which can also be very stressful. So I think it's important for people that are struggling with mental health or have a mental illness. It's not your fault. I think that is something very important that people should remember for themselves if they're struggling, or just if you know somebody is struggling. that it isn't their fault. And it's important to, to help loved ones or your friends or your family or your coworkers, or how to be supportive. Just kind of meet the person where they are. So really hold back your expectations. Make it not about you. Just listen, validate their feelings. Sometimes people just need to vent and then they feel better. So those are things that I just think are important to remember, that I remind myself all the time. And also, mental health should be accorded the same as physical health. And one example would be, if you can't see, you put on glasses, right? That's your prescription. And so another example would be, if you have diabetes, if you're diabetic, you would have to learn how to cope with that and manage that by, working on your diet or your exercise or maybe medication. And so that would be the same with mental illness. So, you just have to learn how to manage it, how to cope as with a physical illness. And I think that's it. I'll end on that note. Thanks everyone for listening.
Thank you, Martha. Thank you to Julia and Jamie and Lee. Does anybody have any questions? While you're thinking, I can start. So this is to any of the speakers, if you have thoughts. Say if you know someone needs help, but they're not reaching out. Are there ways that you can, I don't know what even the right question is there anything you can do to get them to the supports you know that they need?
So I can start. Kind of three thoughts come to mind. First one is, I remember when I did my training in suicide risk assessment, the facilitator gave this metaphor of, if you were driving a car and your car had a big hole in the bottom of it, and someone comes up to you and says, hey, how's your car doing with that big hole in the bottom? If you have the hole, you're just going to be like, yeah, it sucks. And you'll be happy that they asked you. If you don't have the hole, then you'll just be like, no, I don't know what you're talking about. So for me, the takeaway was always like, there's no harm in asking. People worry about asking or approaching someone and talking about their mental health because they're worried like, oh, I'm going to step on some toes, or I'm going to make them think about that. And it's not really true. If people are thinking about mental health stuff, they are going to be happy to be asked. And if they're not, then they'll just say like, I'm okay. I think you're sort of thinking more about scenarios where maybe you have approached that person and they're kind of resistant and they don't want to, reach out. In that case, there's two things. One, I think it's just helpful to then reach out for yourself, because that's really stressful to have to be supporting someone who's having a really hard time and they don't, for whatever reason, want the help right now. So any of those lines, that we're talking about, these mental health lines, the Toronto Seniors Helpline, the walk-in, like any of these phone numbers you could call as a caregiver and talk about your experience, right? And so I think that going through that experience is really hard, of wanting to help someone and you care about them and maybe you can't for whatever reason, and it would be helpful then to take care of your own wellness and whatever's coming up for you, right? There is only so much you can do, and I would say, talk to them, be curious, just be a listening ear, let them know I'm here for you, maybe share resources with them. But at the end of the day, if they don't want that help, that's okay. And then then you might have to get the support for yourself as well, because that's really hard to be a caregiver in that situation.
Those are all great points. I think also as a parent, there are, if it's coming from a parent, there are groups to learn about how to communicate and how, maybe learn about what mental health struggle the person or your child is going through. So you could take the step yourself to learn, and that might actually spark an interest in your kid, or it will actually just maybe help you communicate better with them, since you might have a better understanding of how to react or how to approach things, and also just having a list of resources when that person is ready to say, all right, great, here, let's try this, or
Wow. I'd just like to, it's Mike. I just wanted to make a comment on what was said there. First of all, the amount of care and resources and willingness that is evident, I wasn't aware there were so many options, is so commendable, because I think the world really goes around with people who really genuinely care, and sometimes in the whole spirit of volunteerism. But I'm a student of a science called Dianetics, and there's just with regards to that last point, where a person may not want to reach out for help, but yet they're stressed. There's a very much a self-help book. It's written by a famous humanitarian. His name is Ron Hubbard. He's known worldwide, and the book is called Self-Analysis. And the interesting thing about it is that it has to do with reinforcing the positiveness that does exist in everyone's life, if you look at it. And there's a specific technique on how it's done, and it can be done totally solo, because what I've noticed, what I've seen, is to the degree you can reinforce the positive aspects of one's livingness, one's family, one's choice, one's schooling, the things that are good about living. You free up anxiety and all kinds of inhibitions that a person has. So it's an exercise. It's something you work at. But the best time to make decisions is when you're feeling positive, not when you're feeling really negative. So there's a systematic way of doing that. And I'm a student of the subject. I just wanted to mention it. They do have a center on Broadview
Mike,
near
did you have any questions for anybody else? Because I'm seeing another question in the chat.
Nope, that's it. That's all I want to say. And thank you.
Great. Sorry,
Right.
I just wanted to get on because I see that Sasha has a question that she wanted to raise.
Totally.
Okay, great. Thanks, Mike. And she wrote it out, so I'll read it. How can you help someone struggling who is staying in the anger/depression stage? How can you help them with their resilience and reframe their mindset?
tough question. Anyone?
Yeah, I mean, it's hard. I know it's not the answer that you're looking for. I do tend to believe that that when you're noticing that and you're wanting to help someone and it seems like for whatever reason they're stuck, that at that point it's helpful to actually turn inwards, right? Practice the self-care strategies for yourself, practice the mindfulness that Lee Koo was talking about, right? Like just noticing how hard that is to be with someone who is stuck in that. But that's so hard to witness that of someone that you care about. And if you can kind of do that, that's going to cultivate compassion, right? It's going to cultivate self-compassion for yourself. It's going to cultivate compassion for the other person, and continue to be curious and patient. The only other thing, I feel like this is similar to the first question that Kelly Lynn asked. I mean, the only other thing I thought of was to invite that person to do something with you that's kind of wellness related, but not talking about it explicitly as like, hey, you should go work on your mental health because you're depressed and angry, but more so of like, hey, I found that the yoga studio in our neighborhood is doing free classes right now, and I would love if you would come and join me for a 10-minute session together. And if you hate it, you don't have to do it again, but I would love to do this with you. And just finding some shared activity together during this difficult time, rather than needing to be explicit, like you're still supporting that person and you're still helping them work on whatever it is that they're struggling with.
That's great. And I think also Mike made a good point when he said, you know, when you're feeling bad, you're not going to be making the best decisions necessarily. So maybe if it's, whether it's yourself or somebody else, maybe approaching when you see it's a better time than when they're in the state of, you know, a difficult, challenging time. So I think that's a good suggestion.
Leslie, you had your hand up? Unmute. Karen, can you unmute?
Yep, there you go.
Can you hear me now? Sorry about that.
Yep.
Just a suggestion. You know, we're all dealing with some level of stress with the COVID, and I'd recommend to people that, and it works for me, is not to be addicted to news, because the news is so horrible these days that if you watch it all day long, you're going to feel stressed, you're going to feel angry. So listen to music, get away from the news, maybe watch it once a day. And I advise people, if you have friends that are going through stress, advise them to try to use this time when we're sort of isolated to try to learn something new, take the opportunity to learn something new, take up an interest that's online. And I find that I have done that, and I find that helpful.
Nice. Speaking to that point too, I was just thinking, like, when people are talking about being productive and you know, like trying something new, and that is helpful if I do that to help myself. But I also think just remembering that sleeping is productive. Sleeping repairs your healing at that point, your mind, your body, so, you know, I'm a big fan of naps. So I just think that's, you know, when people are talking about being productive, sleeping can be included in that productivity.
Totally.
Hi, it's Julia. One of the things that we often talk about is in conversations about with folks who are struggling is, and Jamie and some of the other practitioners will really be familiar with this, is we talk about strength base. You know, talking about how people have coped well in the past. Because sometimes when we're faced with really challenging situations, we forget that we've all been through tough times before. And to kind of reflect upon, you know, what has worked for us. Because sometimes we do forget that the resiliency that we all have, and having that kind of little bit of a nudge to remember those things that we've been able to do that has helped us through previous tough times can really be meaningful.
Yeah. That's good.
Sorry, I just wanted to, again, it's Julia, I just wanted to kind of note something to an earlier question about when folks, like, how do you open up the conversation? With seniors that we work with, who may be what we call decompensating really quickly. So their situations may be really changing really quickly and they're deteriorating really fast, especially with isolated seniors or frail seniors who don't have that social support. One of the things that I would definitely recommend is reaching out to the Toronto Seniors Helpline, because we do have the mobile crisis team that will still go out and knock on doors. In those situations, we don't actually need the person's consent. If you're concerned, about a neighbor, you're concerned about somebody else, you really think, they're not doing well, you can actually call Toronto Seniors Helpline and ask whether the mobile team would be able to go and do that in-person visit just to make sure things are okay with that person. Sometimes in the past, what we've had is that our teams have shown up and the and people are surprised and say, actually sometimes they tell our teams to go away, but sometimes, what happens, like, I'm so glad you're here. So that's also a good option to have, is that if you are noticing, or if you know people who are noticing things are not well, um, that they can reach out to Toronto Seniors Helpline and ask for our crisis outreach service for seniors team to see if they can do an intervention either by phone or even in person.
I have another question. You guys have described a lot of resources. Do you have any tips for how, if somebody feels that they do need to talk to somebody, how do they choose? Like, I understand if you're youth, there's a certain pocket. If you're an adult or a senior, there's pockets. But even within those pockets, there's an awful lot of choice. And you're talking about even more resources coming available. How do you know what's the right one? Where's the right place to start?
So it's Julia. I'm just going to jump in there. I don't think there is a wrong place to start. Because
Okay.
I think there's a lot of resources. You can kind of there's often a lot of description around these services, so you can actually figure out sometimes by looking at the description of the service to see whether this is useful or not. But I also feel that sometimes it is a bit of a match that not all services are suited, and people have different expectations too. That's the other thing, is that I might be calling, for example, for Toronto Seniors Helpline, you call and the person really connects with the staff on the phone, so they really love talking to that person. Sometimes what happens is that they call and they will not be able to necessarily feel as much of a strong connection. So for me, I don't think there's a wrong door. What I think is to encourage people to say that, if the first experience didn't go that well, you know what, don't give up, because there are a lot of services. And I do think that people will find one that they can really connect with.
Great answer. Okay, so we're coming up to 9 o'clock, and we know that people will have about a 1 hour limit. We can keep talking if there are questions.
I just noticed there's a question in the chat from Liz about setting limits with your involvement with a person that's struggling. And I'm sure Jamie and Julie might, or anybody else can add in, but I think one thing is, yes, you're entitled to set your own boundaries. You have your own limits, and that's fair.
Yeah, it looks like, Liz, like you're on the right track in terms of using I statements to talk about how it's impacting you. One of the therapy modalities that I really like is called dialectical behavior therapy, which really just means this dialectics is this idea of holding two opposing ideas at the same time. So it can be rainy and sunny. You can love someone and be angry with them. So I tend to find that helpful, of saying, like, I care about you so much, and I want to be there for you, and I need to take care of my health at this point too, right? So a tip for all people trying to communicate around mental health is replacing all of your buts with and. So rather than being like, I want to help you, but I got to go do this, it's I want to help you and I need to do this for me right now. Right. So just like opening that space to be able to hold space for that other person and hold space for yourself, that both are really valid.
Could I make a comment about resources?
Yeah,
absolutely. Sorry.
The resources tonight have been fantastic. I'm a therapist in private practice, and I think that's also a great resource for people, that when they're looking for someone, to look at someone that may be working in private practice. I know that costs more money than a lot of the programs that people have talked about tonight, which are fantastic. And I think a resource for people to find someone in the community is Psychology Today, and to look there for a therapist that would deal with some of the things that they're looking for. The other comment I want to make is what we're experiencing is really hard. I think we just have to acknowledge that. It's not that I get concerned that people are pathologizing what their experience is, and that we're having serious mental health issues, but what we're dealing with is really difficult. And I think if we come from that place, it's a little easier than I have to go get some help for my mental health. Because there can be a stigma attached to mental health. And if you're a little more, everyone at some point needs some assistance. I know I have. And I think it's being human that at times, and what we're experiencing is something I hope we never have to go through again. And it's going to be a long time till we get back to whatever normal is.
Good point.
I actually had a question as well. It's Joanna. And it's actually great what you said, David, because I wanted to just touch on something I think that Lee mentioned earlier about, introverts and extroverts kind of dealing with the situation a little bit differently, and introverts being generally a little bit more okay with things. But I do think it is different. It is weird, even for introverts. And I'm just wondering, for people who are likely to think that they're fine because they don't need that much human interaction anyway, what are some techniques that you guys may be able to recommend around just how to identify that you like on the surface you may seem okay because you consider yourself an introvert, or that there may be more happening that a lot of people aren't necessarily recognizing off the cuff as being kind of mentally affecting them?
So my go-to lately has been, I'm big on sort of acronyms or phrases. So I've been enjoying the 3 N's. So noticing, naming, and normalizing. So just paying attention, noticing what's happening in your environment, noticing what's happening in your body, naming that, like, oh wow, like I've been a bit more tired lately. Or, for me, what I've been noticing in this time, I'm getting way more headaches. And so just like even naming that, like, oh yeah, like I'm noticing I'm getting headaches, and name that, and then normalizing it, of like, which I think was to David's point of like, I'm having a normal reaction to an incredibly challenging situation that we've never been through before. Right. But I just think it is taking that time to just kind of check in with your body, and thinking about it might be showing up in ways that you wouldn't necessarily think of weird stuff around, like just stuff around food, stuff around sleep, physical pain. It could be showing up in so many different ways.
Hi, it's Julia. So I definitely would echo what Jamie's saying in terms of the importance of noticing and naming it and normalizing what you're going through, and especially for Joanna, to your point about someone who may be more introverted and saying, like, this is just the way it is. I'm probably coping better, and I'll use a very personal example. What I've started doing is actually naming things for the folks that I work with, because I recently said to my team, I said, I'm please notice if I'm crankier now than I used to be, and I'm less patient than I used to be. You notice that, excuse me, it is very much the sign of the time in terms of the stress that I'm feeling. Um, in my work, in my life. And so, it's the situation that we're all trying to cope, and it doesn't mean that um, we're you know we're worse for it in that sense that um, we're not as capable, uh, because we are dealing with very extraordinary times. And I think just always reminding ourselves that these are extraordinary times. And to Jamie's point, is that things will come out in very, very different ways. But recognizing it and really speaking to it, I think is very powerful. And also, I think it helps with our relationships. When you name it and you're able to say, you know what, I'm not the way I am before. Um, I'm also trying to deal with the COVID situation as well. And having a little bit of that vulnerability, I think goes a long way.
Now, Dawn has asked, what did you see in the community that encouraged the organization of this town hall topic? And I think this was Karen and Lee and I deciding that, and maybe you guys can talk about why you thought it was a good idea, but I know I was feeling, particularly at the beginning of lockdown, that it was like good days, bad days. And, I felt if I was feeling like that and could use some help, then probably other people were too, and that this would be a good way for us to reach out to the community and try to help each other.
Nice.
Yeah, I think that's right. And you see in the paper, there's a lot of discussion about dealing with the mental health, the anxiety that this whole situation is creating, and how do you deal with that anxiety? And some people are saying, well, you should learn something totally new, or you should do something sort of great while you're in this time. And I think there's a lot of pressure in that way. And I don't know that that's really appropriate, because the best thing you can do is to be able to successfully get through this kind of situation and move forward. And if you need a little help, then that's good. But I don't think there should be pressure to perform.
For myself, I think I definitely noticed early on the anxiety that was building with a lot of my students and a lot of the people who were around me, and whether they vocalized it or they didn't. And so what I try to punctuate was to provide useful tips. Like I started on my Facebook, I'm like, okay, for my 5-year-old daughter, now we're homeschooling, right? Like, or we're home with her all day. And so I saw in my own daughter that creating a routine and creating a schedule, and the schedule is not like 9 o'clock to 10 o'clock, you're going to do this. It was things like activities so that she could see what her day would look like and feel like she had ownership of what her day, like she would plan her day, where she would plan snacks, dance, recess. Like we put in recess to sort of get outdoor time. And so in that routine, it also transitioned to myself, because all of a sudden I was working all the time because I was taking care of a 5-year-old, tag teaming with my wife when we had meetings and what have you, and then staying up really late at night. And this goes to Martha's point, get sleep, because you can't burn yourself out on both ends. And then I also very much noticed that on my Facebook posts, everybody would like all my pictures of food, or like really like certain things that didn't have a stigma attached to it. But when I would do a mental health check, like, hey, how are people doing? Or I would say, here's a post that I think like recognizing the stages you're going through. Like there's a great article about the whole Kubler, like 7 steps of grief.
Yeah.
And I thought it was a fantastic article. I posted it, and I feel like less than 1% of people commented. And the next time I posted something that was lighter, people but I know people read it, right? But then people would post. And so I recognized that we are all facing this. Like, it's not even just us in Toronto, Danforth, it's us in Ontario, Canada, the globe, right? We're going to come out of this, I think, very much changed and needing to be more gentle and kind and working through PTSD. I don't know. I mean, David, you know, whatever your thoughts are, I'd welcome that. But I just noticed a silence about wellness. And so for me, when Kelly Lynn, Karen and I were talking, we're like, we need to do something about this, right? Because we were seeing this in all of our circles of communities.
Nice.
Just to respond, I totally agree with you. We don't know how this is all going to end up. And I think there will be a lot of stuff that's going to come out once we get back to whatever that new normal is. So I think you're right. And the article you're talking about is Harvard Business Review.
Yeah.
It's the Kubler-Ross, and it adds one more step, and it's I'm going to forget. It's like meaning. What's the meaning of everything that we're going through? Yeah. When we experience grief, there's a meaning. There's a purpose to it. I found it very helpful. The article as well.
Yeah.
That was going to be my comment. I feel sometimes some sadness come over me, and I realize it's because of the loss of the life that I had before. And I do know about Elizabeth Kubler-Ross's grief and death and dying and whatnot, but it applies to any loss that anybody has in their life. And I'm glad you mentioned that, but I haven't read that Harvard Business Review article, so put it in the...
With the organizers, I can email the organizers the article if you want to send it out to the people on.
That would be great.
That would be great. Yeah.
Thank you.
I'll do that.
Okay. Well, don't want to keep people too long. I think that this has been a fantastic discussion, and I just want to thank all the speakers. Thank you, Lee and Martha and Julia and Jamie and everybody who came, and even those of you who left early because you had to. It was a great conversation. So thank you all.
Thanks for inviting me.
Yeah. Thank you.
Happy to be here.
Everybody.
Thumbs up to everybody.
Yeah.